morning. Thanks for joining us this morning. When Steve asked me to come and present this case, it was a life changer, I guess for all of us, but for me, it will always be a life changer because having a positive outcome, it just reinforces everything that we're here for, what we're working for. It's always hard to go after Sheila because she's phenomenal. It's like, seriously, she's too good. But honestly, she's the star of this whole thing. I was on Jordan's case as well. I'd had 5 prior cases as well. None of them survived. I trained in Dallas, which we have a current case going on right now. And so I saw this a lot. I was not expecting this at all until I got the call from Sheila. But, I just move forward and hope for the best. But these guys do an amazing job. So I always want to thank Jordan's Smelski Foundation. They just, they made everyone, help on these cases. And for me, it's still, I don't think it'll ever go away. And so I think this is a great thing that you guys do. And so, but I still remember Jordan that day, and I wish, I had the same enforcement for Jordan because I think it's getting strong the way we're fighting against this. So here I have no financial disclosures. That the day that Sheila called, I was in the ICU. I do both critical care and emergency medicine, and I'm just a clinician that's experienced at least 6 cases. But she called, and with her eyes, you saw the video how blurred. You couldn't even see that, to be honest. And at the beginning, we didn't even ask, have you gone into warm water or anything like that? And then once she called us, we went back and asked, and sure enough, he had gone into water. But to start off, so PAM affects now more. Numbers have changed. It was 143 reported cases in the U.S. from 1962 to 2018. There was 1 last year as well, and Texas is getting hit hard. And the mortality rate now approaches to 97%. And that's from Sebastian Deleon. He dropped that rate down from like 99 just from his survival rate. But until 2015, there were only 4 well-documented survivors in North America. PAM continues to threaten over waters with continued summits and the awareness more survival cases can be reported. Today I discuss the successful treatment of the 5th survivor named Sebastian Deleon. His successful treatment emphasizes the importance of early diagnosis and early treatment, like what Sheila Black mentioned. We have now it's been, I guess, 3 years now. So back then he was 16 years old. He was a healthy male who presented with progressive headache for 2 days, throbbing, constant to top and back of the head, subjective fever for 1 day, emesis, and photophobia. He had come for Disney from Fort Lauderdale. They live in Fort Lauderdale. He was visiting the parks. He spent the prior day at Universal Studios, and I still recall that he was in the Universal Studio, and his family was like, wait, he didn't want to go on any rides. This is not normal for him. He used to be a camp survivor in Fort Lauderdale, and he's like, no, I never got in the water. The kids go in the water and all this stuff. He did horseback riding, but little behold, he actually had stepped in the water. He had gone last day in camp prior to coming up here. He had no sick contacts. Otherwise, family history was normal. And then he had normal vaccines. Normal child, normal 16-year-old. But 4 days after the water exposure, he developed moderate frontal and occipital headaches. He developed subjective fever on the 3rd day of illness. And that's the key. The problem is that every child, fever. I mean, you're not going to think amoeba. You're just going to be like, oh, it's a fever. Let me just give him some Motrin or Tylenol and call it a day. But then, that's where some families, no, I still hold. I'll just give him some Motrin and Tylenol. And that's the key to try to figure out something's wrong. But they decided to bring him to now Advent Health emergency department. And that was the other key. Sheila on board. We had Steve Shelley. Everyone's made the hospital at Florida Hospital aware of this disease. And there's 3 children's hospital in Orlando. They choose Advent Health, out of the blue. They just Googled it. So he presents normal physical exam. Temperature was only 99.5, completely normal. Only thing that was different was that he had the mild nuclear rigidity, no rash, and he had the photophobia and the positive Kergnick. So there we were thinking something meningitis at that point. Far-fetched from amoeba at this point. We're thinking bacterial. His lumbar puncture was performed. He had an opening ICP of only 6. CBC was normal. All the other labs were normal. 2 hours after his LP was done, the amoeba was visualized in the telemetry chamber, and these findings were confirmed with pathology, and that's when Sheila Black calls the ER. He was still in the emergency department. This is around, get this, it was Sunday at 1 o'clock in the afternoon. And so they call me, it's around 3 now. I call the CDC because I knew right away, this is only at the time. It's a Sunday, how are they gonna get me the medicine? And so at that point, methotrexate was just mentioned. It was in the blue. I didn't even know if we have it, how long does it take? Normally it was overnight and it would come the next morning. So I called the CDC, and the CDC, made me aware that methotrexate, because of the Jordan Smelski Foundation, was actually moved to Orlando. Here we go. We have the company in Orlando, and so the CEO of methotrexate, Pavito, comes to the hospital and brings the medicine for me. At this point, neither did I know that the medicine was a pill form. Okay, the kid's almost in a coma, and I need him to swallow the medicine. So we get an MRI just to make sure we get a baseline, because he was having already some weakness. And the first MRI that we got had a left anterior frontal cortical focal thickening and some signal abnormality because he was having some reflex changes. And so we wanted to make sure at baseline what was going on. We also did a CT, and it was stable. So I called, the kid comes up, he was still awake, big headache. We couldn't have the lights on, and we have a whole team. I tell the family, at that same weekend, we had 3 other cases in the country. North Carolina, 2 in Texas, actually 1 North Carolina, 1 South Carolina, 1 in Texas. And so it's all over the news. The family's reading the news. I spoke to them, do not Google anything. This is every case is by case basis, don't look at it. And I recall that same Sunday, the South Carolina girl passed away. And so I call, thanks to Dr. Cope. She, I think, called me the next day, if I can recall. But, I was working with everybody. From what I recall, I had my infectious disease doctor was traveling in Colombia, and both and I trained in the same facility in Dallas. And so we worked together on several cases before. And so I said, I know you're on vacation, but I need your help. And so I know there was several cocktail medicine that we need to give this child. And so I honestly started my cocktail. I started the amphotericin B in the ER prior to even coming up. He was still awake. And so when I got the medicine, I said, are you able to swallow? And he was able to swallow the medicine, the methotrexate. And sure enough, at that moment, he swallows it, and sure enough, I felt at least 60% we were going ahead, because moving forward to a positive case. The fact that he was awake and he swallowed it made me, excited. So full force, I tell the family, could you back up a little bit of the slide so I can mention the other medications? So the treatments of most survivors out of the 4 all got amphotericin B, rifampin, the azoles, and the steroid. But from the last 2 ones, we added azithromycin. And methotrexate is this drug that we're all researching and studying about. But never, it's hard to study a kid or any child with either meningitis and see how methotrexate works. He also received Vanc and ceftriaxone because of bacterial meningitis. We still didn't know, which one he was, if it was amoeba or bacterial meningitis. And so at that point, I started to tell the family that I was gonna actually have to put him asleep and intubate him, only because it progresses really fast. Within a few hours, the brain swells and he won't be breathing anymore. So I called my friend neurosurgeon Sunday. Remember, now it's 3 o'clock. What do you want from me? I said, please do me a favor. I need an external ventricular device. I don't know how I'm gonna do this, but I figure if I put medicine in his brain directly as well, it might affect this. And so sure enough, he came to me at 4 o'clock. He puts an EVD in the child's brain, and we give amphotericin as well in the brain. But all this was done within everything, treatments. I cooled him down. And the reason why I put him in a hypothermia, just because, the amoeba actually, if it's cool, will form into a cyst form. So in my mind, I'm like, well, will be less eating of the brain swelling, cool the temperature down. Again, it's hard to do this because this is not research. It's all clinical at the bedside. How do you get a child with this? And so I cooled the temperature down to 33 degrees. His blood pressure was a little soft, so I had to add dopamine on board. But like I said, it slowed down to the cytotoxic killing of the amoeba. It forms a cyst. And so With all that on board, all the 6 cocktail medication, I put him in a penobarb coma, and then I cooled him down, all to see if this would work. No clue at this point, because most of my other cases weren't that successful. And so we move on. We move on to waiting, just waiting. We would send samples every day to the CDC. So this is how it looks when it's a cyst form. And so in my mind, like I said, it would be less cytotoxic killing to the brain, and that's what causes the brain swelling. And so I went ahead, 33 degrees Celsius, he was tolerating it, all normal vital signs. We would get a CS, and then with the external ventricular device, we were able to get a sample of CSF every day, and we would send it to the CDC, and they would confirm positive every day. On day 2, the CDC reported the presence of N followed by the CSF by TACMan-based real-time PCR, and they kept on reporting until day 8, which is the last day of treatment, is when they reported it negative. At that point, we're like, wow, that's the first time we ever heard of that. I've never gone this far. Never gone this far. It's negative, stable. So on the 3rd day of the hospitalization, I weaned off the penobarb coma. And the rewarming, because really when we cool a body temperature, really you don't want to go beyond 4 days. Day 3, day 4, because all the other organs start affecting because of the temperature. And so sure enough, kidney, you're concerned, the liver, and all that stuff. So now we have another issue that's going on. So we start rewarming him, and you got to rewarm him very slowly, 0.5 degrees Celsius every 6 hours. He developed acute renal failure on day 4 and fluid restriction, and then we started hemodialysis. And his creatinine level, his kidney function actually rose to 5 by the day 8th of the hospitalization. So he required daily dialysis. These were the actual antibody testings that we would send to the CDC, and an antibody titer of 1, greater than 1.6, greater than 1 to 64 is considered positive. His level rose all the way to 1 to 128. And we kept on just sending it to the CDC to see exactly, where we're at. So then Sebastian started to breathe over the ventilator. This is when we got, okay, this is very exciting. It's exciting news. He had a cough, he had a gag. I would tell the family I don't know, what to expect at this point. The fact that he is awake and he's breathing on the ventilator is great. We don't know what effect his brain had at this moment. He did develop the hyperreflexia of his lower extremities and clonus. That was concerning. I mentioned about the MRI, which showed the signs of cerebritis. That was expected, especially on the left frontal lobe area. And then we weaned off the sedation at this point to see what he could do. And so he wakes up, Sebastian wakes up, and we are super excited. At this point, he starts, on the 9th day, he spontaneously opens his eyes. On the 10th day of hospitalization, he was extubated. And this was the epiphany, the moment of just, I still, even when I think about it, I get my head all that. So we extubated him, and he was able to answer questions. But the funny thing was that for us, the first thing he actually said is, "I can't breathe." And to the family, they're like, "Oh my God, he can't breathe." To us, we're like, "No, he said that he can't breathe." He's cognitive there. He's thinking. They're like, wait, misconnect. We're not understanding. He's not breathing. I'm like, no, he's breathing. It's just that he's having difficulty. He's understanding. Huge for us. And so obviously he demonstrated increased cognitive capability. He had no motor deficits, and he had advanced improvement of his strength. I mean, it was amazing. This was his labs when he went home. Everything was normal. The Amoeba we had, the last one before because he went to rehab, was 1 to 128, but we kept on following every month. I have some amazing pictures of him, but so he completed the course of PAMP on his 13th day of hospitalization. He was transferred to a rehab center on the 20th day of hospitalization. He went to St. Joe's, but he was discharged home on the 37th day of hospitalization, which is amazing. He received continued physical, speech, and occupational therapy as outpatient. His renal function normalized, and his hypertension resolved shortly after his discharge, which is phenomenal. So in summary, he came to us. He received a 7-drug antibiotic parasitic drug for 28 days. He was cooled, coma. He lost 20 pounds overall, despite all this. And then he went to St. Joe's Hospital, and till today, the St. Joe's has been great as well. They still call us to find out how he's doing. And so he had, with all this, despite the amoeba, acute kidney injury, he had hypertension, the weakness, weight loss. He had continued tingling for about 6 months. Very mild, and mostly because of the medication. And then, all that gone, all that gone. We have him here at the rehab center. He very, very, weak, completely weak. Couldn't even go up the stairs. He had lost, besides the 20 pounds, he also lost a lot of muscle mass. Obviously, that happens in the ICU a lot. Him trying to do, that initially was like just 5 pounds. He couldn't even do that, to do the triceps, 5 pounds he couldn't do, he was telling me. And then, so we had a follow-up. He came back a month after. But he still says he fatigued easily, had no fevers, no GI issues, no respiratory problems. His vision was good, no hematuria, everything. And he was actually still, just to protect his brain because of cerebritis, we still had him on the Keppra. But he reported that still the tingling. Besides that, everything else was going good. And then the nephrology was our still concern. He developed AKI during his hospitalization and required the hemodialysis treatments. But his urine output had continued to be good. He had no complaints, no gross hematuria. The serum creatinine that we had initially was 5. It came down to 1.03. His blood pressure was high still, but we discontinued his Norvasc in February of 2017. And then the MRI had complete, on February, resolution. His internal resolution of focal cortical thickening and sigmoidoscopy. There was no other new acute cranial pathology at all. And that's what we can't study that. We don't have live brain tissue, but at least with these images, he went from something to normalcy, which is amazing. Like Sheila mentioned, if you ever get a moment, besides the videos on George Smelski, you gotta have to watch Something's Killing Me. It was a great, well-done CNN show about the stories of Kyle Lewis, as well as Jordan, as well as Sebastian. Well done. Texas is one of the states that, besides Florida, definitely has a lot of cases, and something like, with Jordan, Smelski Foundation, these videos will continue giving great awareness. I wanted to be able to, unfortunately, present Sebastian Deleon here today, but guess what? He's in college. He's great, he's in college. Steve tried and as well, at least to get a video. He's like, I got homework to do. I have job, I work now, I have a girlfriend. And so it's amazing. He's, he's thinking to do like Dr. Cope. He's telling between Air Force and studying medicine. I'd say, do what you gotta do. You have one life to live and you have it, more power to you. But he's very excited. He really apologizes for not coming here today because he definitely thanks everybody here. But it's amazing that he's able to say that. So I'm really, really excited. I really, really thank you that I could present this case. It will always, always, always be a part of my life, and I'm sure of yours. It was a great team. Sheila, I don't know where you are. I can't see you. But you're a blessing in disguise as well. Without you, obviously, you're the one with the eyes. But I really, really appreciate you guys. This should be and continue ongoing. I'm sure Dr. Cope will mention, updates. There is one case going on right now in Texas that have been calling me. They just decided to cool him this morning. So hopefully that family is doing well. But it's an ongoing thing, and I think awareness makes it aware that we have more cases than what we think. And so I think everyone who's doing the research, everyone who's doing the CDC, it's amazing. Keep it up, keep going. It only helps me. I'm just a clinician, but without you guys, I can't do much. And so I really appreciate it. I want to thank everybody again, and have a good day. Thanks. Yes.
Do you not worry that cooling will induce cyst formation, and then the cysts will be harder to kill with the drugs?
I did. That's a good question. That was my, at the moment I didn't want at least the amoeba to grow. I needed more time in my mind, to CDC to give me more answers. And so I knew that it helps with cerebral edema, metabolism of the brain. So at least that part I could try to protect the brain and let the amoeba not grow as much. So it was almost like a standstill for me at the same time, so I could get more help. And yeah, I mean, I didn't know that the cyst would actually kill, be able to kill, and obviously it did, which worked out. But yeah, at that point, no, I didn't. I needed time. This thing is so fast. With Jordan's case, I mean, it was just, and I didn't want that. And so I was like, what can I do to pause everything, to stop it for a moment? And so I thought, cyst form is not going to grow. If it kills, it's great. And at least the cerebral edema, which is what really causes the death, is not to let it happen. So yeah, that's a very good question. I didn't at that point.
So my other question
Yeah.
is, so he was on HD, emergency HD, and I'm
Yeah.
assuming that was from the amphotericin,
Correct.
right?
Correct.
So it seems that amphotericin is really critical in the cocktail, and I'm wondering about, so the first presenter was saying how, empiric therapy needs to be started if we suspect it before we have confirmation.
Right.
But my first thought was like, we're gonna give everybody amphotericin.
Absolutely. No, it's a cause and effect. Its benefit outweighs it, absolutely. We, and that was something, because we had a scare as well last summer, or 2 summers ago, a family of like 9, ended up being, I think it was rhinovirus. Same thing, same symptoms. They were at the lake in Orlando, and it was 9 of them, and mom was pregnant. And so had the symptoms, and mom was rhinovirus positive. She was actually induced labor, and we had to give her empiric treatment with amphotericin. So absolutely. We haven't seen it that quick. We try to do like 1 dose, and we try not to see the side effects as fast. But yeah, absolutely. It's almost a side. What can we do? Benefit outweighs death, and so we try. But yeah, absolutely. We all think about that process because amphotericin, it is very, very kidney, cytotoxic. So, but those are all things that we have to think about. Absolutely. Any other questions? Yeah.
When the body temperature was lowered to 33, was there anything that showed that they actually did insist and not that they didn't just stay trophozoites and that you did just in fact
I know, and
slow
that's
their
where it's hard. That's the ongoing. That's
Right.
hopefully I will start doing research on that. That's exactly what we need to find out.
Because I don't know if 33 would cause them
Yeah,
to insist.
I mean, we've had some that will, some that won't. So, and it's still not that cold
Okay.
for them to insist. But we don't know I think the real protective point was the cerebral edema. And so I don't, overall.
Absolutely.
But yeah, that's a good question too. I mean, that's what we need to study, exactly in cyst form with the different medicines or forms that we have to see what the killing effect. That's a good question.
Yeah, I just want to comment on this 33 degrees. We grow our Naegleria fowleri in the lab every day at 33.
Right.
They stay
right.
trophozoites to eat. They continue. So it's my belief that the 33 degrees, the really impact is what you said about
Right.
the edema and the brain swelling, which causes the significant pathology that results in
Correct.
the fatal
Correct.
outcomes. And as far as I know, there's really no evidence that I've ever seen of cyst in Naegleria in the brain. Maybe Jennifer or somebody can
Yeah.
comment. So I really believe that this 33 degrees may slow them down a little bit, but it's not going. We grow all different strains of Naegleria fowleri
Right.
at 33.
And that's what, that's what we need to show. I think it was more the impact of slowing down. In my mind, it was that slow it down, less reproduction. And again, I don't know the amount of reproduction, but it would be to slow it down versus cyst form. And then the key real factor is the cerebral edema. That's what really protects them. That's what
I had a question.
Yes.
So I know there's not been research as to what temperature would cause the encystment, but I was wondering if there's anybody looking at if there are any drugs that may promote encystment.
That's a good question. So any drug that would, if I'm correct, any drug that would cause encystment
Yeah,
of the.
that would induce it.
I don't think. Yeah, I don't think so. I mean, like exactly. I would think treatment would be a lot harder if it did. Yeah, that's a good. I mean, I don't think so. The killer form would be trophozoite, I would think, versus a cyst form. For me, it was more slow down, give CDC time for me to help get more research, more data on treating the patient versus because it's such a rapid illness.
I will say that for Canthamoeba, in the lab when we give miltefosine, the ones that survive become cysts. And a lot of the experimental drugs we try in the lab on a Canthamoeba, if you if it's not enough to kill the amoeba, but it's enough to make it unhappy, then they will insist.
They will insist.
Which is a
Ah.
problem of drug screening.
That's interesting. Did you hear that? That was interesting. That's actually really cool.
Humberto,
Yes, hey.
Really appreciate yours and Sheila's presentation today.
Thanks,
It's nice to hear
thanks.
the personal part of that. I was wondering, since people are calling you from all over the country, are you aware of how many kids now have undergone hypothermic therapy? And
Not many still do, believe it or not. I thought, I thought again, a lot of stuff, treatments have side effects, but I've gotten maybe 4 or 5 cases this year that they call me about, and only 2, and now today, the hypothermia with the kid and children, but not many do it, and that's the only difference, to be honest, that I could actually support, is protect the brain, because we don't have live study, and so at least protect the brain, and there's some data in adults, and children is really hard. It's hard to do hypothermia, and with brain swelling in children, it's children. But today was the first time again that Cook's called, but otherwise not many are doing it. And to answer that also, we are having a paper that's going to come out, and so we hope that people will use the paper and try at least. It worked, and so hopefully they will listen and read the paper, and this is what helps. The awareness and stuff like that. It should be broadcast nationally, internationally. We have more cases, but the paper will help.
is there a movement to make an IV form of methotrexate?
Yeah, that's a good question. I spoke to Todd this morning. That's from the researchers, to do. I mean, that's the goal. Cook's was actually one of the first ones to have it in-house in the hospital. And so hopefully this case goes well as well. And everywhere, we're trying to push that across the board. And that's through the help of the Jordan Smelski Foundation. You get the awareness, and then more hospitals will listen. So, oh, yes.
Amphotericin B is an antifungal, and it works by preventing chitin formation or chitinase activity. Is it the same mode of action when it comes to?
Yeah, pretty much.
Yeah, because the amoeba actually, when it insists, it forms a chitin as well too. So it's the same mode of action, right?
Yeah,
Okay.
pretty much. These are all good questions. Anyone else? I'm just glad people are actually interested, because it affects Florida. It's affecting the north as well. I mean, there's been cases up in Minneapolis. There were some cases. So I agree. I mean, 33, they still grow. It was more, again, the protected of the brain, which is what really keeps them alive. But thank you so much. This is a great, great conference. And keep up the good work, guys. Thank you.